Hi, I'm Dr. Christopher Miller, and I'm president of Total Health Chiropractic here in Grand Rapids, Michigan, and I'm here today to answer questions about how does the DRX9000C spinal decompression machine actually work, and how can it help you? Well, the spinal decompression machine, called the DRX9000C, is a medical device that's used to heal and repair injured discs and degeneration of the spine and symptoms associated with that. So with stress in our lives and neglect, our spine can degenerate and basically decompose or rot away. And that's what these models here show. You can see in a healthy spine the discs are very thick, they keep the bones separated so that the nerve exiting has plenty of space and it's not pinched and everything feels good and it works good, and that's normal. But again, with these stresses, the discs can actually dry out and start to thin down. So in this model here, I hope you can see that disc is very much thinner than the original model I pointed out, and the opening for the nerve is much smaller. That's spinal stenosis caused by this disc drying out and degenerating, and it can lead to severe pain and pinching of the nerves. So another problem that people could get is the discs could then start to bulge or herniate out, pushing into the nerve, and many times that will cause more of the neck or back pain, but it could affect the extremities, the arms or the legs, with electrical shooting type pain. It could be a burning sensation, pins and needles, or numbness and tingling, or sometimes it can even lead to weakness of the extremity, where people have trouble using their arms or using their legs to get around and perform daily functions. So many treatments are simply to minimize the pain or the symptoms, but the problem persists, and that's why you have to keep doing those treatments over and over again. And what I'm basically talking about is oral medications, spinal injections, or even surgery. These are treatments to mask the pain, not necessarily correct this degeneration. Well, the spinal decompression actually corrects this, and what it does is when we find what level in the spine is the problem, for this example, let's say it's an L5 degenerated and herniated disc pushing on the nerve, very similar to this, we can program the machine to target L5 alone. We're not working on any area or stretching any other area in the spine other than the L5 vertebrae and your sacrum. And because we can get that precise, we can apply a much stronger decompressive force to actually separate those two vertebrae. We don't have to worry about injuring any other areas because we're only working on the one level. And when we can separate the vertebrae to the degree we do with spinal decompression, it actually creates a vacuum effect within the disc. And that's how these bulges or herniations are actually sucked or drawn back into the disc area where they should be. And at the same time, nutrients and fluids are drawn into this disc, so it actually can rehydrate and thicken up, and it goes back more towards normal and more of a healthy disc. Pressure comes off the nerves and people get pain relief, but the extremities start to work better again. And again, it's because we've corrected the problem, not just masking the pain. The final key point that makes spinal decompression very effective is that for most patients, when you have an injured, irritated area and you mess around with it with treatments or things, the body has a defense mechanism which basically starts to spasm the muscles in the area to splint and protect it so no further damage can occur. And that spasming effect happens with things like chiropractic adjustments, physical therapy, traction, even spinal decompression. But this machine is so sensitive, hundreds of times per second it's monitoring how is the patient responding to the treatment, and if the muscles start to tighten up, the machine senses that before the patient even notices it, and it actually backs off and it stops pulling so strong until the patient's body is able to relax, understanding that it's not pulling so strong, it's not going to be injured, so it can calm the muscles down. When their body relaxes and the muscles calm down, the machine senses that as well, and then it gradually starts stretching and separating that again. So over the course of the treatment, the patient is basically tricked into a state of relaxation so the machine can actually separate the vertebrae and change those discs. So again, they get healthier and the patient gets out of pain. And you have to fix the problem, not just mask the pain, if you're going to have long-term relief and be able to start enjoying your functions and activities in your life once again. And those are the treatments that we offer here at Total Health Chiropractic. Thanks so much.